Hi, I'm Sally Osborn, and I'm one of the post-transplant nurse coordinators on the UC Health transplant team. Let's talk about activity. We recommend for the first 6 weeks after transplant that you do not lift anything over 5 pounds. For the first 6 months after transplant, avoid any strenuous activity, heavy lifting, or more intensive exercise programs. The best activity in the first few weeks after transplant is walking. Since each patient's recovery post-transplant is different, we recommend that you ask the team what's best for you. If you ever experience any intense pain, chest pain, or shortness of breath while exercising, you should stop exercising immediately and seek medical attention. Regarding returning to work or school, before transplant, many patients were too sick to continue to work or go to school. But after transplant, most patients are ready to return to work or school within 3 months. When possible, it can be helpful to return to work or school on a part-time basis. You can gradually increase your hours as your energy and endurance improves. Discuss returning to work or school with your transplant physicians and transplant coordinator. They can help you decide on the time that is best for you based on your workplace and responsibilities. Regarding driving, we recommend no driving for the first 6 weeks after transplant. Your reflexes and judgment may be affected from the prolonged hospitalization or from certain medications, so it's best to discuss this issue with your transplant physicians and coordinator before getting behind the wheel. It's a good idea to practice driving in an open lot or away from other traffic for the first time as you get used to driving again. It may be helpful to have another licensed driver in the car with you for the first few times that you drive after transplant. When driving or in a car, always wear a seatbelt, even if you still have an open wound. Patting your abdomen with a towel or a small pillow will help cushion your abdomen from the seatbelt. The seatbelt will provide a safe restraint in case of an accident. Regarding routine screenings and exams, you should plan to see your local primary care physician about 2 months after your transplant surgery. Your primary care physician will continue to manage your routine physical exams and your general health, immunizations, and issues such as high blood pressure, diabetes, high cholesterol, or illnesses not related to your transplant. Your transplant doctors will keep your primary care physician informed about your transplant and will partner with your primary care physician for your overall health. We recommend that you see a skin doctor or dermatologist every year because some of the transplant medicines put you at a higher risk for developing skin cancer. Always wear hats, protective clothing, and lotions with sunscreen on any skin exposed to the sun. This will help lessen that risk. We also recommend annual DEXA scans, which are special x-rays which measure bone density. This is recommended because transplant recipients are at an increased risk for developing osteoporosis. It is also important to keep up with routine professional eye exams, colonoscopies, prostate exams, and gynecologic exams, because you may be at greater risk for developing problems due to your suppressed immune system. The frequency of these exams can be determined on an individual basis by your primary care physician and other specialists. If you are thinking about becoming pregnant or fathering a child, please schedule an appointment with our transplant team to evaluate your individual situation and make adjustments to your medications if necessary. As Sarah mentioned, you must bring your medication card to each of your transplant clinic visits, but it's also necessary to bring along all other doctor or emergency room visits. This way, everyone caring for you can quickly see what medications you are taking. We recommend that you call your nurse coordinator anytime a doctor prescribes a new medication to make sure it won't interfere or interact with your transplant medications. The UC Health transplant team will continue to provide care for your transplanted liver for the rest of your life. The health of your liver will be monitored with routine blood tests and office visits and other liver tests such as ultrasounds, CAT scans, or liver biopsies as needed. Typically, long-term patients who have good liver functions usually have checkups in the outpatient transplant clinic once a year and blood tests every 2 to 3 months. Our medical team will continue to manage your immunosuppression and partner with your primary care physician, who will manage your routine health care. Smoking is dangerous to anyone's health, but it's even more dangerous to transplant recipients. Therefore, for the best outcome, all smoke should be avoided. Recreational or illegal drugs, including alcohol, must not be consumed in any form after transplant. Many of your necessary medications are metabolized or broken down in the liver. Alcohol, which is also broken down in the liver, would cause unnecessary stress on your transplanted organ and could destroy liver cells. If abstaining from alcohol is difficult for you, let your transplant team know so that you can receive help. You may find yourself experiencing difficult emotions following transplant. Sometimes some of your medications may contribute to your emotions. In the early months following transplant, some patients experience feelings of anger, frustration, guilt, or depression. The transplant experience can feel overwhelming. Let your transplant team know how you're feeling so that you can receive help. As a transplant recipient, you have many responsibilities, including attend follow-up appointments in the transplant clinic as scheduled, have blood tests drawn routinely as instructed, monitor and record your weight, vital signs, and blood sugars every day, limit your activity during the early post-transplant period, and schedule routine health screenings with your primary care doctor and other providers as recommended. Avoid behaviors that lead to health concerns and complications after liver transplant. Maintain regular contact with your transplant team through your nurse coordinator to avoid complications and ensure continued recovery after liver transplant. We realize this is a lot of information and it can be overwhelming, but we are here to help. Before you leave the hospital, your post-transplant coordinators will help you schedule your first clinic appointment and will make sure that you have everything that you need. The entire team of experts at UC Health cares about you and your liver and wants you to enjoy a long and healthy and productive life with your liver transplant. You are the most important member of this team, so welcome.